Well, good morning, everyone. How are you? Good morning. It's Monday morning. It's okay. It's really okay. Anyway, I'm very pleased to be here to welcome all of you to Better Medicare Alliance's third annual Medicare Advantage Summit. So good start. I see a lot of good, happy faces, which is great on this hot Monday morning. You're all just happy to be in air conditioning, right? Is really what it's all about these last few weeks, for sure. I want to just start out by, of course, thanking the co-chair of the summit. Again, this year is Jerry Penso, the president and CEO of the American Medical Group Association. Thank you for your partnership around the summit. Thank you for your partnership about on really advocating for Medicare Advantage and the transformation that's happening in Medicare Advantage, which is what we're going to spend 2 days talking about. And I do want to also thank our sponsors. There are a few of you in the room who sponsored this summit this year. We're delighted about that too. Particularly our platinum sponsors who are CVS Health and Lyft. So if you see them, thank them. Really appreciate that very much as well. And I want to thank many of you who are the speakers for today's summit as well. A lot of you are BMA allies. So really appreciate the fact that you are here and that you're sharing your insights and your experience. It's why we're here. And many of you are staying throughout the whole 2 days, so we appreciate that as well. And I do want to thank my staff. I was going to do that at the end, but I figured, you know what, let's do it now. They've really done an amazing job. I want to particularly recognize Robin Garaki, who was our chief of staff, who has led the way on this and done everything around this summit. But to the whole team, thank you for everything you've done to lead up to today and what you'll be doing during the next 2 days. If you have any questions or concerns, look for one of the staff members. You probably know them, and if not, meet them. Actually, in fact, the staff should stand. So why don't you each stand and see James, I see Jeremiah, I see Robin's back there. Any questions, concerns, ways we can be helpful to you today or in the future, just let us know. As many of you know, BMA is a unique national alliance of healthcare stakeholders that include the provider groups, the health systems, health plans, aging service organizations, professional associations, and business and community partners, as well as beneficiaries. Together, we are now 135 organizations and over 400,000 beneficiaries who support and advocate for Medicare Advantage. We know firsthand that Medicare Advantage is leading the way in innovative financing and delivery of care that is the future of Medicare. And that is what's inspired the theme of this year's conference, which is innovation in Medicare Advantage. As we gather here today, healthcare continues to be top of mind in Washington. Almost every day, policymakers are talking about healthcare, from high prescription drug prices to the future of Medicare. We recognize the very real issues that are driving this discussion, including the concern about out-of-pocket costs, the high cost of prescription drugs, particularly specialty drugs, and the continuity of care, and concerns about continuity of care. We're proud of the fact that Medicare Advantage offers older adults and people with disabilities high-quality care that they can count on at a cost they can afford. And as we'll be discussing over these next 2 days, we are very excited about the work that's being done to transform care to meet the needs of today's beneficiaries. More than 1/3 of beneficiaries under Medicare, you may know this number, 22 million people, over 22 million people have made the choice of Medicare Advantage, and the numbers are growing. As beneficiaries tell us themselves, they appreciate the quality, affordability, care coordination, enhanced benefits, and the consumer cost protections available in Medicare Advantage that's not available in traditional Medicare. Today, it's Medicare Advantage that is addressing the needs and expectations of consumers in innovative ways and creating a model for the nation. From telemedicine to care in the home, Medicare Advantage is providing opportunities to give people the care they need while addressing clinical and non-clinical needs in integrated care systems. I, for one, enjoy my Apple Watch. I did pay for it myself, my plan didn't, but it tracks my steps, it's my heart rate, it even prompts me to breathe deeply once in a while, which I completely forget to do, or stand up when I've been sitting for too long. Personal devices, remote monitoring, virtual patient visits, and telecommunications between providers are all becoming the reality of modern healthcare today. These new technologies and the promises they bring to monitor our health is exciting indeed. But we are also witnessing a modernization of care built on some of the most basic concepts that are essential to living healthy. Concepts like preventing illness, managing chronic conditions, slowing disease progression, that includes the ability to access healthy foods, to exercise, socialize, care for ourselves, and to have access to the providers we need at a cost we can afford. We know a system of care that both acknowledges the importance of technology and the importance of social supports is the future of Medicare. The future of Medicare is a system that combines clinical care rooted in patient-centered primary care with smart benefits based on value, tailored to patients' needs, and responsive to each person's individual health goals. The future of Medicare is a system that gives patients access to a team of doctors who can track your health, anticipate your risk of disease, and can develop a plan of care to enhance your chance of better quality of life, even as you age. That is the kind of healthcare available today in Medicare Advantage. Enabled by new laws and policy changes, forward-thinking plans, and innovative providers, entrepreneurs, and community partners, Medicare Advantage is bringing a new era to Medicare through a drive to value risk-based payments, new delivery models, and enhanced patient engagement. It is transforming healthcare every day across the nation, and patients are embracing it with coverage and care that it provides. So just a couple of recent notes. I asked my staff to just pull a few stories from, just little brief vignettes from some of our own storybook beneficiaries who talk to us every day, pretty much, on Facebook or email, about how they feel about Medicare Advantage. So Ms. Brown from Texas City, Texas wrote, "I have Medicare Advantage, and so does my mom. The policy has been a godsend for us. We have dental and optical care besides our medical and pharmaceutical needs. My mom just had a pacemaker surgery. A nurse contacted us and made 2 home visits already. The nurse ordered frozen meals and had them sent to her home, and they were really good." She actually goes on for a few more paragraphs, but I'll stop there. But Mr. Rayer wrote us, and he said that I have a Medicare Advantage plan. I've been a member for 5 years. During that time, I've been an active user of silver sneakers. I have had several surgeries due to disc and hip issues and received great care and follow-up rehab. Plus, I also received ongoing follow-up contact and food while I was recovering. My plan has been quite useful, and I want to be able to maintain this valuable program. And last, Ms. Jordan from Savannah, Georgia, who wrote, "I believe Medicare Advantage is important to me because it provides rides to and from my appointments at no cost. That in and of itself is a lifesaver because I don't drive and transportation is not always available. They truly care." So while it's early in the morning, I say we should cheer for all of you who are making this happen. Cheer for all of you who believe that we can offer better care at better cost for consumers and for our nation. You're doing this by aligning goals and getting people the right care in the right setting with the right provider at the right time. You're creating efficiencies, anticipating needs, driving value for beneficiaries, and as a result, enhancing the chance at a best quality of life as we grow older. While there's much to be proud of in America's healthcare, it is too confusing, too often, fragmented, and costly. We know we can do better, and we are. The change you're leading in Medicare Advantage is as exciting as it is important. It's modernizing Medicare, and it's offering lessons that are already having a positive effect on the rest of healthcare. This summit is an opportunity to listen and to share ideas and action that is propelling this transformation, to hear about the work being done to build on advances in technology and data analytics, to highlight the simple truths long ignored in healthcare, to provide better care for millions of older adults, many of whom are living with serious, multiple chronic conditions. At BMA, we believe that working together with all of you, that we can build on these innovations and modernize and ensure the future of Medicare. And that together we can lead in ensuring that healthcare is high quality and accessible and affordable for everyone. What we do in Medicare matters to everyone else in the healthcare system. Thank you for what you do, and enjoy the next 2 days. So.